So what's the difference between conventional medicine and functional medicine? And what's the deal with that? So we're going to talk about that today. Hey everyone, Josh Rimini here, your functional pharmacist, and we're going to talk a little bit today about the difference between conventional medicine and functional medicine. So there's a difference between the two, and the real difference between a conventional approach and a functional medicine approach to medicine is really exploring the why. In the conventional wisdom of medicine, it's very symptom-based. We want to go to symptom resolution. And so when we look in that lens or that mindset, we're really looking at the downstream effects of the health. Okay, so a good example would be blood pressure. The symptom of blood pressure is the systolic and diastolic, heartbeat, all that type of stuff. You go to the doctor, they take your blood pressure, and then they give you a drug that will help with the symptom of blood pressure. But the difference between the functional medicine approach is exploring why. Why is the blood pressure high? There could be many different factors. It could be lifestyle factors like stress, which is a big one. Food we eat, all the types of things, my genetics, all the looking underneath the hood, if you will. Another good component of difference between conventional wisdom or conventional medicine and functional medicine is conventional medicine is dictated by the healthcare provider, whereas in the functional medicine approach, we're really taking a patient-centered approach, and we're empowering the patient to be their own health advocate. There is no wrong between the two, but what I've found with functional and blending the two together really makes the best outcome. That conventional wisdom isn't enough is really the best way to say with functional, because it serves a purpose and it's an underserved space in this community that we live in and in this country for sure. So a functional approach would be, let's start here. Let's start with diet, lifestyle, and explain it to the patient of why it's important, because food is medicine. 80% of functional medicine is actually food. People don't realize that it's, I'm not just giving you all these supplements and all these tests. If you can work on nutrition, stress, sleep, relationships, and movement, you've done most of the work. That's the 80%. I can't tell you how many times I've had transformational turnaround in someone's health by focusing just on that. Now there's some supplements and some tests that we do to personalize it and to make it more impactful to them, but focusing on those basics 80% of the time generally does the trick, right? Conventional wisdom doesn't focus on that. They focus on the symptom and the medication, and they think that that's going to do the work. We're not displaying that drugs and medications aren't important. They are from an acute perspective, but when we really want to get down to true healing, I firmly believe the functional approach is the way it's at. So don't forget to subscribe to our channel. If you're interested in learning more about this functional approach versus conventional approach, we're gonna have lots of more content on specifics on all of these things. I'm Josh Rimini, just reminding you to live better, stay well.